Cardiovascular disorders or history. A thorough history is fundamental. It cannot be replaced by testing. The history must include a thorough systems review because many symptoms apparently occurring in other systems are often associated or caused by cardiac disease. A family history is taken because many cardiac disorders have a heritable basis. Symptoms. Serious cardiac symptoms include chest pain or discomfort, dyspnea, weakness, fatigue, palpitations, lightheadedness, a sense of impending faint, syncope, and edema. These symptoms commonly occur in more than one cardiac disorder and in non-cardiac disorders. Cardiovascular disorders testing. Symptoms or the physical examination may suggest a cardiovascular disorder. For confirmation, select non-invasive and invasive tests are usually done. Complete examination of all systems is essential to detect peripheral and systemic effects of cardiac disorders and evidence of non-cardiac disorders that might affect the heart. Examinations include the following: vital sign measurement, pulse palpation, oscillation, vein observation, chest inspection, percussion, oscillation, and palpation, cardiac percussion, palpation, and oscillation, lung examination, extremity and abdomen examination. Cardiac pulmonary arrest. To suddenly withstand a sudden cessation of cardiac output and effective circulation. It is usually precipitated by ventricular fibrillation or ventricular asystole. When cardiac arrest occurs, delivery of oxygen and removal of carbon dioxide stop. Tissue cell metabolism becomes anaerobic, and metabolic and respiratory acidosis ensues. Immediate initiation of cardiopulmonary resuscitation is required to prevent heart, lung, kidney, brain damage, and death, also called cardiopulmonary arrest. This is a table for CPR. Medications. Epinephrine is an endogenous adrenal hormone and a synthetic adrenergic agent. It acts as an agonist at alpha-1, alpha-2, beta-1, and beta-2 receptors, also called adrenaline. Indications. It is prescribed to treat anaphylaxis, acute bronchospasms, and nasal congestion, and to increase the effectiveness of a local anesthetic. Counterindication. The known hypersensitivity to this drug prohibits its use. Adverse effects. Among the most serious adverse effects are arrhythmias, increase in blood pressure, rebound congestion when it is used as a decongestant, tachycardia, and nervousness. The second drug is vasopressin, a hormone secreted by the cells of the hypothalamic nuclei and stored in the posterior pituitary for release as necessary. It constricts blood vessels, raising the blood pressure, and increases peristalsis, exerts some influence on the uterus, and influences reabsorption of water by the kidney tubules, resulting in concentration of urine. Post-resuscitative care. The immediate goals of post-resuscitative care are to provide cardiorespiratory support to optimize tissue perfusion, especially to the brain, transport the pre-hospital cardiac arrest patient to the hospital emergency department, and then to appropriately equipped critical care unit. Attempt to identify the precipitation cause of the arrest, and institute measures such as antiarrhythmic therapy to prevent recurrence. Immediately after resuscitation, patients may exhibit a wide spectrum of physiological states. Patients may recover fully with normal hemodynamic and cerebral functions. At the other end of the spectrum, patients remain comatose with cardiac respiratory abnormalities. All patients require careful, repeated assessments to establish the status of their cardiovascular, respiratory, and neurological systems. Clinicians should identify complications such as rib fracture, hemopneumothorax, pericardial tamponade, intra-abdominal trauma, and misplaced tracheal tube. Modifications for special circumstances. Drowning requires immediate rescue breathing even before the patient is out of the water, followed by chest compressions if they are pulseless. Hypothermia, which is a body temperature of less than 30 degrees Celsius or 86 degrees Fahrenheit. Elevated pulse and breathing for a long, evaluate pulse and breathing for a longer time frame, and then aggressive intervention. Pregnancy. Best hope for the fetus is mom's survival. Because of the location of the fetus, resuscitation will need to be modified. Epinephrine must still be used because a safer alternative does not exist. Trauma. You have head and cervical injuries. Precautions need to be observed. Need rapid transport to a facility with expertise in trauma cases. Electric shock. When approaching patient, make sure you are safe. Often associated with multiple trauma, and you need to evaluate these factors. Drug administration. Routes of administration are IV, both central and peripheral access, IO, injected directly into the marrow of the bone, and endotracheal. Hypertension is high blood pressure. Blood pressure is the force of blood pushing against the walls of the artery as it flows through them. Arteries are the blood vessels that carry oxygenated blood from the heart to the body's tissues. Hypertension is a major health problem, especially because it has no symptoms. Many people have hypertension without knowing it. In the United States, about 50 million people aged 6 and older have high blood pressure. Hypertension is more common in men than in women, and in people over the age of 65 than in younger people. More than half of all Americans over the age of 65 have hypertension. It is also more common in African Americans than in white Americans. Hypertension is serious because people with the condition have a high risk for heart disease and other medical problems than people with normal blood pressure. Serious complications can be avoided by getting regular blood pressure checks and treating hypertension as soon as it is diagnosed. If left untreated, hypertension can lead to the following medical conditions: arteriosclerosis, also called atherosclerosis, heart attack, stroke, enlarged heart, and kidney damage. Typical physical examination to evaluate hypertension includes medical and family histories, physical examination, ophthalmoscopy, examination of the blood vessels in the eye, a chest x-ray, an ECG, blood and urine tests. Mean arterial pressure. Systolic pressure is the blood pressure when the heart is contracting. It is specifically the maximum arterial pressure during the contraction of the left ventricle of the heart. Diastolic pressure refers to the time when the heart is in a period of relaxation and dilation. The mean arterial pressure is calculated by using the formula 1/3 systolic blood pressure plus 2/3 diastolic blood pressure. Clinical presentation and classifications. Risk factors for hypertension include age over 60, male sex, race, heredity, salt sensitivity, obesity, inactive lifestyle, heavy alcohol consumption, use of oral contraceptives. Blood pressure measurements are classified in stages according to the severity. Normal blood pressure less than 120 over 80 millimeters of mercury. Pre-hypertension 120 to 129 systolic, 80 to 89 diastolic millimeters of mercury. Stage 1 hypertension 140 to 159 over 90 to 99 millimeters of mercury. Stage 2 hypertension at or greater than 160 to 179 over 100 and 109 millimeters of mercury. Lifestyle changes that may reduce blood pressure by about 5 to 10 millimeters of mercury include reducing salt intake, reducing fat intake, losing weight, getting regular exercise, quitting smoking, reducing alcohol consumption, and managing stress. Classes of hypertension medications include diuretics, which help the kidneys eliminate excess salt and water from the body's tissues and the blood. Reduction of fluid dilates the walls of the arteries and lowers blood pressure. Beta blockers lower blood pressure by acting on the nervous system to slow the heart rate and reduce the force of the heart's contraction. Calcium channel blockers block the entry of calcium into muscle cells in the artery walls. Muscle cells need calcium to constrict, so reducing their calcium keeps them more relaxed and lowers blood pressure. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, block the production of substances that construct blood vessels. They also help reduce the buildup of water and salt in the tissue. They're often given with patients with heart failure, kidney disease, and diabetes. ACE inhibitors may be used together with diuretics. Alpha blockers act on the nervous system to dilate arteries and reduce the force of the heart's contraction. Alpha and beta blockers combine the actions of both the alpha and beta blockers. Vasodilators act directly on arteries to relax the walls so blood can move easily through them. They lower blood pressure rapidly and are injected in hypertensive emergencies when patients have dangerously high blood pressure. Peripherally acting adrenergic antagonists act on the nervous system to relax arteries and reduce the force of the heart's contraction. They are usually prescribed together with a diuretic. And centrally acting agonists also act on the nervous system to relax arteries and slow the heart rate. They are usually used with other hypertensive medicines. The in-class activity, you'll read out the handed out packet in your notebook. And in your notebook, answer the following questions. In the United States, what % of patients doing regular checkups still have hypertension? Why is this important? Discuss the three main groups of patients with untreated hypertension. Compare and contrast them. What should be done with these three groups? And discuss the new approach to treating currently uncontrolled hypertension. Compare and contrast what you wrote down with what others did in class. We will follow this with a whole class discussion. Before leaving, turn in I learned an improvement note card to me covering both classes. Be sure to write the date at the top. As homework, finish reading chapters 13 through 16, 19, 22, and 23 in section 2.